Tipparat Udmuangpia. It's very nice to meet you guys, and I'm so excited to meet you guys here today. So I am a assistant professor from Praboromarajchanok Institute from Thailand, and I've been working for intimate partner of violence and for since 2017. It's about 8 years already. So I got a K43 Emerging Global Leaders NIH funding from the US. That Jane is one of my mentors. And thanks for the CITR for welcoming and hosting me to be here. So it's my second week for Auckland, New Zealand. And I will be here until February 6th. And hope I can meet you guys in person and learn from you guys. So can I start with sharing about my presentation? Right. Okay. So okay, can you guys see the presentation? Okay. So yeah, the presentation that I would like to share to you guys about the research that I have been conducted from Thailand, and would like to share about Thailand context, and you guys would think about New Zealand context too. The title is about From Silence to Safety, that the bridge framework and WeSafe digital innovation for intimate partner violence prevention in Thailand. So as we already know that IPV, so IPV is intimate partner violence. IPV is not just only global issue, but is like a crisis issue as well. So the statistic in global, like 1 in 3 women globally experience physical and or sexual violence by their partners with their lifetime. So in Thailand, that well, I think it would be referred to global as well. That violence is not just a private matter, but a fundamental violation of human rights and global public health priority as well. So what we stand for Thailand. So you can see that Thailand is here. And even though that our number is average, but we know that it's underreporting for sure, right? And Thailand. So I'm not sure that have you guys been in Thailand before, but the culture in Thailand is a collectivist society that is strong family and community ties and social harmony and avoidance of conflict. And the wife try to save family face to be beautiful. However, however, that the silence is reality, that violence is private family matter and saving face, and we have the script about one life, one husband, that women have to be trained and taught about that. But right now the trending is changing about one life, one husband as well. So, and also about cultural factors influencing the outcomes as well, that, people think about families' privacy, think about karma, And so, for example, the karma, they said that the women, the survivors said that uh, the things that the husband just hit them and violated to them because the result of the past action or destiny that she has to be in with. So this is the one that, especially from the women in old generation, they still talk about that. That's why they try to be patient with this, and they don't want to talk to anyone that would make the violence more severe on that. So today I would like to share about my research since 2017 until 2025 that I've been for 14 interconnected studies and already have published in 7 published articles and 3 under review and one ongoing RCT for that. So for this one that I did narrative synthesis, and then I have 3 themes that would like to share to you. The first theme about cultural foundations and health seeking, and the second one is about healthcare system and healthcare response, IPV. The third one is about technology-enabled interventions. So these are the references of my study that I will talk today. So for the 8 years. So IPV prevalence in Thailand. So right now that the prevalence that I talked to you, that the statistics showed to you before is about 14% of women who have violence by partner or former partner by their lifetime, and 22% by their within a year, within 12 months. So it's a lot, right? It's almost 1 in 2 and almost 1 in 4 for that. However, that we show that my study, I asked pregnant women, 340 pregnant women about their experiences about violence. We found that in Thailand, they have experienced violence in any form, at least one form, for 53%. That is a lot. But the most form would be emotional abuse, right? And the second one is sexual abuse and physical abuse accordingly. So you can see that 47.4% here is emotional abuse. Is about 7 times higher than physical abuse. That is a lot, right? And also my study showed that pregnant women who have experienced abuse, they have the higher risk of pregnancy complications and recent stress when compared with pregnant women without complications and no stress for that. And also, just only 12% of them had ever been asked about violence by healthcare providers. So these things that I'm thinking about systemic failure as well, that, about screening and asking violence from women. So from 14 studies that like I said, that the first discovery about culture script. So I named that about the hidden trauma network. So when we found that, for my study, we found that survivors, right? When survivors they have violence experience, they don't talk well. They talk to their friends, their family, their communities, and their providers too. But in Thailand, about almost 90%, they reach out to their friends and their family. I'm not sure about the New Zealand on that, but kind of like a former support and former network for violence against women in Thailand. We have established the resources on that, but 90% of Thai people, they don't know about that. They don't know the hotlines, they don't know about the NGOs and kind of thing. So that's why the first responders would be their friends and their family. So I named that. So I named their friends and family that about helping in silence. They help the survivors, but they're helping in silence about that. And my study that I asked friends and family who experience helping survivors, it's interesting that they also have secondary trauma as well. So they feel emotional exhaustion, they feel guilt, they feel fear as well. So I think this is the point that we have to think and concern about informal supporter as well. So yeah, these the patterns that is from my study. You can see survivors, they reach out to informal network, right? Almost 90% for that. So the formal gap for that. So the gaps for this one that firstly about secondary trauma, right? Um, another gap is when I interview informal networks, they say that they don't have knowledge, they don't have resources, they don't know how to guide, how to suggest and feedback to them. They just use their experiences on that. So yeah, this is very interesting for Thailand about that. So and the barriers to health seeking, not just only from survivors, but also from network supporter as well about family matters, private family matters. So they said that it's just only my things, it's not your things. I should not, talk about it to outsiders, right? And they try to have saving first, make sure that their family would be beautiful and family harmony and calm mind, fear of judgment. The one that for my when I interview people, I mean participants talk a lot about fear of judgment as well. That they would blame survivors on that. That's why they don't want to talk to outsider. So the secondary discovering from my study is about the wills and the way phenomenon. So my study found that even though informal networking, informal supporters, and healthcare providers, they said that they would like to help and they would like to ask, but they lack of the ways to do that. So they have high intention to do that, but they don't know how to do that. And our systemic infrastructure could not support on that. For example, for my studies that I asked future nursing students, so the last year of nursing program about their intentions to screen women for violence. They have their high attitudes and high intentions about that, about 90% of high intentions. And the subjective norms, yeah. So all of this, they say that, okay, I would like to do that, especially about students who have experienced violence and have experienced family violence before. They have the high intentions for that, but they don't know how to do that too, right? Because I'm not sure about the nursing curriculum in New Zealand. You guys at how many hours, or do you guys have the course for nursing students to do that? But in Thailand, we just added like a few hours for talking about IPV, talking about violence on for nursing students. So these are the gaps that we have been working on that too. And also, my study that I asked healthcare providers and about IPV screenings and train them about how to screen by using the LICE approach from the World Health Organization. So we found that providers have the high intention and high attitude to screen women for IPV, but for the real situation that they don't have screening form at the department. They don't have the private room. They don't have yeah, guide and kind of thing to talk to women about that. That is another examples of there's the wills but lack of the ways gapped for Thailand. Yeah. And also about the barriers to screen that I got from my study, we found that from individual level, they lack of confidence and skills and have the fear of offending and personal discomfort to ask about that. And they said that sometimes it's not my duty. So in Thailand, it seemed like they said, talking and working about IPV, it seemed like for social worker or nurses who have been trained for this. It's not just only for general nurses or midwives and kind of thing. And also about systemic level for that, lack of privacy that I talked to you before about crowded clinics, and especially about outpatient department in Thailand, especially in the tertiary hospital, about 2,000 patients a day. So it would be very crowded and don't have the area, the safe space to talk about, and time constraints as well, and heavy workloads, leave no time for counseling section. And also, they have no reference protocol. Even though we have, you may hear about the one-stop crisis center in Thailand. So in Thailand, we have the one-stop crisis center or OSCC model approaching for helping women against for helping women for that. But not all nurses or healthcare providers know about that. So they still have some problems about this as well. So the third discovery things that we have found from my study about technology as a cultural bridge, that when I talk, right, my studies talk to survivors, talk to their supporters. So they found that they don't they don't know how to reach out, how to seek out, seek help to resources. And also people, they're scared with people, they would judge them about that, right? And probably shame and judgment for that. So we thought that digital would be another one that would help them for that. That would be the bridge for them. So we started with using a systematic review and review about the AI and digital health to help survivors and their supporters as well. So for my study is systematic review and meta-analysis as well. So you can look through that too. So we found that digital technology to help intimate partner violence is significant improvements. So it's including the web-based applications, the mobile, the mHealth, all kind of thing, the chatbot as well. So it's significant improvements for that. And it's improvement in mental health and in safety planning and self-efficacy as well. But it's still no significant change in re-victimizations that they said that technology alone did not significantly reduce the recurrence of physical violence that we have found from our systematic review and meta-analysis for that. And also we did a systematic review about the roles of AI in IPV prevention. There's right now this study is under review and hope it would be published so soon. So we found that there are many type of AIs to help IPV preventions, including natural language processing (NLP) that can help detecting hidden IPV patterns and help about record EHR and report and social media posts as well, and have the machine learning model about risk stratification too, and have the conversational agents that have the chatbot and kind of thing. So I hope that if I have time, I would show you guys about the chatbot that I created for this one, and can use the AI for predicting analytics as well. So yeah, this is the AI study that we found. So this one that I talk about, right? Right now, you can see how AI is being used to combat IPV. So right now, the chatbot for support is the training. I mean, the trending people likely use the chatbot for IPV supporting right now. So for my study that 14 studies, I propose the bridge framework. So people for my silence is including survivors and also supporters as well. They are helping in silence and how to make them safety in survivors and safety with their supporters as well. So we propose the bridge for that. So the bridge, okay, yeah, I can show you about the bridge on that. And this is the chatbot. So Draw just told me that I have about sorry, I haven't shown you about the chatbot, but probably lately on that. So I propose the proposal to have the NIH funding. So I got the funding from the NIH that I have, I adapt, culturally adapt the My Plan app. You guys have, may have heard about My Plan app from the US that Dr. Nancy Glass and the team, Nancy Glass, Jane, and Tina Broom, and Nancy Perrin, and my colleague from Thailand as well. So adapt to Thailand. So for friends and family, not for survivors. It looks like I self in New Zealand that Jane and Claire working on that. But this one is for Thailand, but for friends and family. So this is WeSafe from Thailand. So it's kind of thing. So right now the WeSafe is ongoing with the randomized control trial to examine the feasibility of adapting the the app for Thailand. So this is the one that I have been my study, and I proposed the bridge framework that talked to you before, that the bridge, why I talk about the bridge. So bridge is B is stand for barriers, and R is stand for readiness. That bridge is inductive framework. It's not just the framework that I proposed before, but it's like I synthesize my 14 research and I got the bridge from that. So it's have the input. Input is barriers and readiness, that you have to think about readiness, that the ways and lack of the will for that. And the process is about innovation, that culturally adapted innovation that you can find, and digital. So the bridge that I would like to focus on digital and technology to help from that. And the output that G is goes for for IPV for that, and the evidence that can be the RCT data or the guidebook or kind of thing. So I just deconstructing the bridge into the things that my research found at. Yep. And yeah. So the next step for that, for my studies, that the next step that I would be like to validate the bridge framework prospectively, that because right now the bridge has a lot of limitations. It's just only my own research that I synthesize. It has, it needs a lot of papers to validate the bridge framework and develop the standardized cross-cultural measurement tools. You can see that we have found about secondary trauma from friends and family. So I think developing the secondary trauma measurement for Thailand would be another one that I am interested in, and also rigorously evaluate technology-based interventions. That is the thing that I think is would be the trend that we should do that, and formalize informal networks as a core IPV response system. Yeah, sometimes, well, in Thailand, we totally forgot about informal networks for, when we held on that. So we need to put informal network into our guideline for that, and regulate technology-enabled interventions. That would be another one too. And shift focus to organizational level healthcare interventions, that you can see that we have the barriers, like individual barriers, we still have organizational barriers as well. So I think need to do together, between individual and organization, and strengthen international collaborations that, right now CITR is very, you guys have been working so incredible and so much supportive for people and international researchers like me as well. So I try to establish the we call the hub of talent and hub of knowledge, but it looks like an international research center for violence against women and children for Thailand. So this is my next step that I would like to be in charge on that. So the vision for impact of my research and my career that would like to establish bridge as a standard framework for culturally responsive IPV prevention globally is the big dream, but just try to dream on that and build evidence-based demonstrating effectiveness of informal network support and digital interventions, and build evidence-based demonstrating effectiveness of informal network support and digital intervention as well. So the conclusions right now that from silent to safety today so I think the wills and way in Thailand is already disconnect and still disconnect. Technology as a cultural bridge, and the system is the network, and cultural scripts as systematic barriers as well, and informal networks bear hidden burden for that. So we cannot change the culture of silence overnight, but we can build a bridge to safety today. So this is my presentation. Thank you so much for hearing me and attending me for that. So I plan to show you guys about the chatbot, but I forgot to put it on here. Yeah, yeah, yeah. Thank you so much for that.
Thank you, Tipparat. That was such an engaging presentation and, right on time too, which is amazing. I think, definitely there's a lot of similarities between Thailand and New Zealand. And I think, your work really highlights the contribution that friends and families can make in this space. In New Zealand, at the same time, it's the friends and families are the first point of contact for most people, and then healthcare follows friends and families. So, really interesting work. Thank you. I'll open it up for questions and comments to the team. Susan.
That was a fantastic presentation. I'm really, I'm so thrilled that I was able to come and listen to your research. Silence is such a powerful barrier, isn't it? It transcends culture, it transcends all sorts of violence. And my focus area is child protection, child abuse, and silence is what perpetrators rely on to continue either perpetrating abuse or to not be discovered and not be revealed. So I was really interested in the cultural adaptation to the notion of silence and the barriers that you have in Thailand about that. So thank you for that. That was really interesting. I really appreciated hearing the cultural differences and similarities of the underpinning fundamentals to perpetrating abuse and keeping it secret.
Thank you so much, Susan. Yeah, thank you.
Moira.
Kia ora. Thank you so much for that presentation. Really fascinating. I'm really interested that you are looking towards AI as a way of managing or addressing some of that cultural bridge.
Yeah.
Because I was really fascinated, obviously, a particularly strong cultural values, beliefs, however you want to describe it, in Thailand. And therefore I was interested in thinking about, so what will you need to shift in that respect to allow for the system to become, you know, in the way that you were visioning it? And then really excited that you kind of think AI could be quite a big player in shifting some of that culture. And, you know, really gutted that we don't get to see your chatbot. Can you say a bit more about what, you know, how you got to that place of using AI as a way of the cultural bridge, I guess?
Yeah, I thank you so much, Morel. Right now I can see my chatbot already. That would you would you like would you guys like me to share?
Yes, yeah.
And all right, okay. Okay. So this is the chatbot that I'm interested in AI personally, and in AI with research. And also when I look to that, AI with research, think about AI and IPV and kind of things. So that's why I try to do that. I created the chatbot from the ChatGPT. We call WeSafe Connect. So WeSafe is my applications, right? WeSafe. So use WeSafe Connect and Safe Companion. So this is the chatbot. Okay, this is the one. And if you go to ChatGPT and you just go to the GPT Explore, and you can type my name and you will see on that too. So for example, this one. So this is the WeSafe. I just type for you to be example for that. So I just type on that I have a case who has been exiled from her husband. She got injuries with her arms and her bruises around her abdomen and legs. What should I do? So this chatbot, it can be, well, you can be providers, or you can be friends and family as well. So, and the chatbot that I use, we self principles on that too. So I said that, hello, I'm Rose, friends. So just my name, Rose, my English name on that. Here to listen and support you. And we just have the guardrail that is a critical safety info, that if is danger right now, you just call 191. Is kind of like a chatbot cannot support you for that. And digital safety, and have the hotline that you can call just in case on that, and let them know about that. So they said that so you are doing the right thing by asking with arm injuries and bruising on the abdomen and legs. Here what to do step by step. So they just this one is just call and safety check and provide the first line support. So I just wrote the course about LEAP's approach from WHO, that asks AI to respond about this. So listen, inquiry, and validate, and enhance safety and support for that, and assess immediate danger signs, and document injuries safely, and offer warm referral now. And so, and also, okay, one questions for you, that is she safe right now, or is her husband nearby or likely to come soon, kind of thing. So if you have that you just tie on that. So, and also I just talk to them that she does not want to to go to the hospital and does not talk to anyone. She could not sleep. She had two children, and they are 5 and 7 years old. So I'm really glad that you're staying with her through this. What are this? So these are the things. So they said that we won't force we won't force anything. The goal is safety and gentle options. So they have the guideline to do that, right? And yeah, this is the guideline that we wrote it. We wrote the code and let them respond about that. So and also so my another question is that I feel unsafe and I'm scared with her husband. What should I do? They said that I'm really concerned for your safety right now. And yeah, if you can feel danger right now, just call blah, blah, blah. So it's kind of like the things that we have put in the WeSafe app, the applications, but just let let people when they ask on the chatbot and let them do that too. So this kind of some examples that we use. Well, it's still gray area. Yeah, it's like when I talk to variant researchers, they said that they're really concerned about safety and hallucination information and data for that. But it needs to do more research on that too. But but the things that I asked participants, they said that it would be the guideline for them. I mean, let them know how to do with survivor first, and if they could not be successful on that, they just call and ask providers on that. Yeah, these are the things.
That's awesome. Thank you.
You're welcome. Yeah, right now just talked to Claire yesterday that I think it would be good to write something on the paper and kind of like a commentary later that let people know that okay, you can use the AI like a chatbot, or you can use the AI agent to help survivors as well. Yeah, it's on the process on in writing on that.
Awesome. Thank you for sharing that. Are there any other questions?
I have a question. In terms of the AI use and the bot use, have you tested that out on survivors, or what was their response? Was it something that then was like a first step that led them to reaching out further for help and support?
Yeah, thank you so much you for asking about that. So actually we wrote the code for survivors and also for friends and family as well. I mean, we just wrote the code that like if you are a survivor, the things that you can answer, and if you're friends and family, you would do something like that too. So it's kind of like a broader chatbot right now. And my friends and I from Hong Kong, that we have the mutual interest right now. We are building the growth standard and compare between the answer from the gold standard and also the AI to compare with that. If it's pretty close each other, yeah, it would be good to go as well.
Yeah, interesting question, Jill. I think one of the things, Tipparat, you were talking about was the referral and not knowing where to refer to. And I think there's, from what I'm hearing in my research, whānau and families talking about the significant uncertainty that they feel with a referral. So you can, as a provider, you can say, you know, you've got Women's Refuge you can contact and do the warm referral. But women are saying, you know, and then what? What will they do for me? What if this happens? You know, they really want someone to be walking alongside them and saying, you know, I'm going to be there for that transition journey for you. I'm going to support you. It's not just a referral. Yeah.
I have, you know, I have another chatbot. It's for healthcare providers. It's called Bridge, BRIDGE. So it's for healthcare providers in my city to refer each other. So the chatbot that I put the referral system and referral guideline and the phone number of providers in each city that, and also put multi-professionals in there, put the OBGY doctors, put the social workers, put nurses, put midwifery agents. It's not the agent, not the real person. And then when you put the case, for example, that case, and then let them help the case for that. So this the one that, yeah, I think it's trending right now, but it still need to do research from that too.
Any other questions, comments? Okay. I'll close with karakia. Thank you so much to Tipparat Ngā Nui ki a koe. Thank you for the presentation and coming all the way to New Zealand to be with us and to share your learning, and yeah, awesome work. Ka whakakapi au ki te karakia. Ka ki roto, breathe in. Ka ki waho, breathe out. Kia tau te mauri kokuri nei, i ngā piki mi ngā hiki, ko te rangimari e taku I rapi nei, tihei mauri ora. Thank you, everybody. Thank you, Tipparat.
Thank you so much, you guys, for having me today. Thank you.
Thank you.